All right, we're going to go through digits 2 through 5 first, and we'll do thumb last. Once again, tabletop, 40-inch SID. I have to have my IR and my tube centered. I'm checking my edges off just a little bit there. Okay, so those are centered. So I'm going to do the second digit first. So where am I centering for digits 2 through 5 for PA and oblique? The proximal interphalangeal joint, which is the knuckle, okay? So I'm going to put it right in the middle there. Make sure the other fingers are moved away from it. How far do I need to collimate out? Yep, 1 inch past the metacarpophalangeal joint, okay? 1 inch on the sides. Marker placement. Tell me which marker am I going to use?
The right.
Right marker, because it's her right finger. And I'm going to put it on the right side. Not in the shadow, okay? This line should be coming straight down the long axis of her finger. Other fingers are separated away. I've got to include that metacarpophalangeal joint, though. I want to see that.
I guess that's why the PowerPoint said that little marker.
Yeah. All right. Next, we're going to do an oblique. So we would just turn her finger up 45 degrees, slide it over a little bit. Make sure that marker stays away from that shadow. Oblique, second digit. If you get confused as to which way to go, some people do their obliques the opposite way so that the finger is closer to the IR. You got to go by department protocol. You have to look in their procedure manual to see how they do it, okay, in their facility. Lateral second digit. We got to get that finger as close to the IR as possible. So she's going to flip her hand over, tuck all her fingers down, bring her elbow over, and I need this lateral part of her hand all the way on the IR. So what I want you to do, and I usually show my patients, ball up a fist, stick your pointer finger out, and lay it flat on the IR. Notice how her wrist is doing. That's kind of uncomfortable, isn't it? Mm-hmm. So I'm going to turn this for her and try to put my IR in the direction that she is. Got to keep these fingers nice and flat. And so what I can do now is bring my tube over, turn the tube head. I'm going to open up my collimation just so I can get everything lined up here. I'm going to go ahead and go to my IR, center to my IR. Make sure you stay at that 40. 40 or 40.1 is fine. And then I'll just put that proximal interphalangeal joint right there in the center. How do I know if I'm in a true lateral here?
The way the nail is.
I'm looking at her fingernail, and that's what I'm going to be checking. The profile of her fingernail should be in a true lateral. Right now, it is not, okay? And what you might want to do with the camera is show from this angle where I am, come to the very front right here. So you can see her fingernail is angled. So what we would do here is we're going to take her hand and turn her up a little bit more till I get that fingernail in a true lateral. So now her fingernail, I can see the profile of her fingernail. Marker placement is, this is her right first digit. So I'm going to put the right marker.
Second digit?
Second digit. What did I say first?
First.
Mm-hmm.
Second digit. Longitudinal line needs to be coming straight down that digit. Put your marker in there and you can collimate in a little bit. Now, how far does my collimation need to be open? Same as it was for your PA. 1 inch past your metacarpophalangeal joint. So make sure you're including that joint. Patient is shielded. 40-inch SID. Remember, you always have a ruler here too. You can check your distance. If you don't have this set on tabletop, that distance is going to be wrong on here. You can always double check with a ruler. That's lateral second digit. Any questions about that? All right, let's go to third digit. So we're gonna do third lateral first. This one's kind of a little tricky because we've got this distance here, right? We've got some OID. So we're trying to see the metacarpophalangeal joint, the proximal interphalangeal joint, and the distal interphalangeal joint. If her fingertip dips down towards that IR, it's gonna close up your joint spaces and you won't be able to see them open. So we gotta keep the finger nice and parallel to the IR, which means the distance from here to the IR and the distance from here to the IR is the same. How am I gonna get these fingers though out of the way? Let me show you a little tip or trick. You can use straws, you can use tongue depressors, tape. For this one, I'm gonna use tape. Tape is our best friend as X-ray techs. We use it for just about everything. And it definitely helps if you don't have gloves on. And if you have fingernails, but we can't have fingernails, so. Let's see. Where's that one? What we're gonna do is I'm gonna put a piece of tape on the end of her finger and I'm gonna pull it back. Notice how much I'm able to pull her finger back. Before I put that tape down though, I wanna keep that arm so that her finger stays nice and straight. And then I'm just gonna put that tape right there. I can just slide her forward a little bit. Voila. So it's pulling her finger back to get it away from the rest of these fingers and soft tissue here. Make sure she's still in a true lateral. That is the lateral third digit. Now, let's do lateral fourth digit. So, gotta keep the finger close to the IR, right? So notice she flipped her hand over in the other direction. That's what's gonna get the fourth digit. Can you hold these knuckles all the way down? It's a little tough for the patient. So what I try to do is go ahead and ball up a fist and try to use your thumb to hold your fingers down. And then you'll have your fourth digit like this. Here's where she can use the tongue depressor. I couldn't use the tongue depressor before because she would have been leaning over the other fingers. Here, she can take this hand and she can lean over, put this at the tip of her finger and push. Push it out as far as you can. There you go. And then I'll just move her finger over. Make sure it's not dipping down. Ball that fist up, and I want to turn your wrist up on the side. I want to get her finger nice and lateral. I also want to see this MCP joint. Can you bring those fingers down anymore?
Okay.
There we go. So my distance is off just a little bit.
Somebody grab the shield for me.
There we go. Now, push, 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 and bring this hand over. Now, put my right marker in there, and I want you to hold still just like that. Don't move. Beep. That would be her lateral fourth digit. And then lateral fifth digit is just the pinky on the IR. Tuck these fingers down as much as you can. Still going to be at the proximal interphalangeal joint. Still got to leave my collimation open to include metacarpophalangeal joint. Y'all come around this way so you can see the shadow of her fingers. That shadow right there is telling me soft tissue from up here is going to be, can y'all see it right there? That shadow? I got to get that out of there. So I want to try to tuck her hand, her fingers, and now notice I don't have that shadow as far up. So try to really get these other fingers out of the way. Look at the fingernail. Turn the wrist. That's your lateral 5th digit.